everyone. Hi, everyone. As we come toward the end of Brain Injury Awareness Month, I would like to welcome and thank you for joining us to discuss concussions and some of the most common myths surrounding them. This is an important issue because, as we know, more than half of concussions are missed in large part because people may be hesitant to seek care. This can lead to not being diagnosed and delaying potential treatment and recovery. Our goal today is to continue to raise awareness of this issue so that we're seeing fewer concussions overall and more recovery when they do occur. I'm Adria Bryant, Project Director for Concussion Awareness Now, a brain trust of partners, including organizations that influence concussion care, advocate for patients, and work with communities who are vulnerable to concussions. Together, we want to create a future where every person with a concussion receives the right diagnosis, the best possible care, and the resources and information they need. You can learn more at concussionawarenessnow.org. I'm joined today by a passionate panel of concussion professionals and advocates. Let's do introductions. Dr. Beth, if you can please share a little bit about yourself and your connection to concussion.
Sure. Hi, everybody. I am a neuroscientist, a neurologist, and a registered dietitian. I'm a medical director here for Abbott, and I lead global neuroscience research. I've also worked with the Department of Defense and some other groups over the past decade working on a blood test to assess brain injury.
Awesome. Thank you. Kelly?
Hi, I'm Kelly Pokrivka, and I sustained a concussion about 11 years ago. And since then, my life has never been the same. And so now I'm on the Brain Injury Association of America's Survivor Council. And I also, in my professional life, I get to interview neurologists and headache specialists and create patient education courses through the Migraine World Summit.
Thank you. Catherine?
Hi, my name's Catherine Snedeker. I'm a licensed clinical social worker, and I'm the founder and CEO of Pink Concussions, and we focus on brain injury in women, and that be sport, domestic violence, military service.
Awesome. And Dr. Drew?
Hi, I'm a neuropsychologist and also a board-certified rehabilitation psychologist. And I've worked over the last 40 years or so in brain injury rehabilitation, including working with mild traumatic brain injury at Moss Rehab in Philadelphia and the Children's Hospital of Philadelphia, and also running a concussion clinic for youth and young adults. Currently, I work on several federal grants that one of them is funded by the CDC that studies return to school following a brain injury, and that program includes a concussion management team approach.
Awesome. Thank you all for introducing yourselves. We're here to start the conversation by busting concussion myths. Before we begin, to our attendees, if you have questions, please put them in the Q&A. If we have time, we'll answer some of your questions live, but either way, we'll respond to you in the chat or follow up with you after the session. Okay, let's get started. About 3 in 10 adults have experienced symptoms of a concussion following a blow or jolt to the head. Concussion can happen in many ways, so let's get to our first myth. Some falsely believe that sports are the leading cause of brain injury, when in reality, concussions happen during many everyday activities, and falls account for about half of all concussions in the US. Dr. Beth, I've heard you say that gravity is in fact the leading cause of concussions. Can you talk a little bit about that and maybe share some concussion causing incidences that we might be surprised to hear about?
Sure, I absolutely say that. And the reason I say gravity is the biggest cause of concussions is because most concussions happen because of slips and falls. So gravity. And what we know is that there are certain age groups that are more susceptible, ages 65 and up, but that said, anybody can fall and it can happen to anybody at any time. So I think it's really important for people to be aware that it's not just elite athletes. In fact, only 3% of concussions in the United States per year happen to athletes. Isn't that shocking and such a surprise? The other thing to know about this is it's completely preventable. So there are things you can do, like putting in grab bars in the shower and making sure you have a nice snug bath mat down, making sure that you hold the railings as you go up and down stairs. So many things. One other one I do want to highlight is when you go for a bike ride with the nice spring weather that's coming out, make sure you wear a helmet in
Yeah,
case something happens.
so important. So important. Another myth that I've heard is that concussions look the same on every person. The fact is that everyone's concussion experience may be different. Just like concussions can be sustained in a variety of ways, we know that symptoms appear differently. Kelly, can you talk a little bit about your experience both as a survivor and an advocate?
Yeah, absolutely. So even within the same person, different concussions can appear so differently. I had so many different concussions growing up, and embarrassingly, I thought it was sort of a badge of honor. Like I was, tough and scrappy playing soccer, and I had no idea. Like, basically a week later, I would be out of complete pain, and then this last one, 11 years ago, I'm still in disabling pain every minute of my life. I have not been outside of a migraine attack since that
Mm.
day. I probably get so nauseated and still, end up throwing up probably 3 or 4 days a week. It's deeply impacted me. And when I say that, I don't want everyone to think that this will be your, trajectory. And most people do not end up with this long of symptoms, but just be aware that it can happen. So don't lose hope, but just be aware. I think the thing that really helped me with categorizing concussions was UPMC's clinical trajectories for concussions, and it really made sense to me. It was sort of a light bulb moment. There were 6 different categories. So cognitive slash fatigue, vestibular, ocular, post-traumatic migraine, cervical, and then anxiety and mood. And once I was able to sort of define those clusters and see which ones, really made sense for me, I was able to find better treatment options and sort of have a direction of where to go for that.
Really good information. Thanks for sharing that, Kelly. Even as concussions are different in different people, I am interested to know if there are trends that show differences between males and females in causes of concussions, but also in resulting symptoms. Catherine, can you speak to that?
Yes, in our past research, it's shown that men concuss twice the rate to women when you're looking at ER people that go into the emergency room. And what we've realized over the last recent years is that there's probably a number of women that aren't going into an ER, and that may be cases of domestic violence. So in the cases we track, men concussions are from sports-related injuries, motor vehicle, violence, fights, workplace incidents. And with women, we also see the sports motor vehicles, but the domestic violence and the assaults come up higher than sort of the workplace incidents. And then women have shown to feel their concussion symptoms and have more intense symptoms and a larger number of symptoms than men. And there is what is seen in research as a longer recovery time. And we're back and forth whether those are biological reasons that the longer recovery time, or women less likely to go in for care or less likely to be taken seriously for their injuries. The jury's still out on that one. But it's really important. And both our research at Pink Concussions and at Children's Hospital of Philadelphia have shown, for example, elementary school, middle school girls are taken in about a week later for care than boys. So it's just really important that if there's a hit, if there's a jolt, if there's something and you question a brain injury, go in and get it checked.
Any other thoughts just about symptoms, long term or short term symptoms that we should think about?
I think it's important to know that a lot of people, the majority of people who have a concussion, their symptoms, they may be intense at first, but most of them start to subside within the first 3 to 4 weeks following the concussion. But it's those that don't subside that we really need to follow because there is help available for them. And so it's really important to be evaluated and to get help from a person, a professional who has training and experience in brain injury
Mhm.
right away so that and to be followed so that we know whether somebody's symptoms have subsided or they're persisting.
Yeah, that's really good.
I think it's also hard because there's a lot of information out there on TikTok and Instagram that may be dated, or
Mhm.
people are pulling, it may be a current video, but they may have pulled from information a decade ago where there was the rest, the dark room, don't stress your brain, where the entire field has switched to approach of reasonable and graduated exercise and moving the body. And you really need to check in with a medical provider before you start that and have proper use. And TikTok may be a very quick way to access some information, but it's often misguided and not the correct for you and your particular brain injury.
Mhm.
One thing I wanted to add here is to echo, first of all, what Catherine was saying about women and concussion and add a few new things. As the field is continuing to evolve, we are leading global neuroscience research and focusing on women and women's brains. And we know there are three main areas that are different for women versus men that can make concussions more problematic for women. Number one is our neck is usually thinner, right? So you have the gross anatomical overlay. Number two, when you zoom in on the brain and look at it at the microscopic level, we have more connections, particularly across our corpus callosum, but they tend to be thinner. So they're more prone to being disrupted. Think of as small side streets versus big, sturdy expressways. And then the third point is we have a neuroendocrine overlay. And what do I mean by that? Well, women, we have different progesterone levels, estrogen levels going up and going down at different times. And depending on where the woman is and where her hormones are at that time, the concussion can be worse in the same woman. So there are so many things that we're learning. And I do want to highlight, you mentioned UPMC, Kelly. We're doing research with UPMC and they are fantastic. That is one of the best areas of research. Dr. David Okonkwo, Dr. Ava Puccio, and the whole team is really knocking it out of the park at UPMC.
Awesome. So one of the things Dr. Drew mentioned is, the importance of getting checked out right away. Sometimes we hear about people using a wait and see approach after they hit their head. So I wanted to share the Brain Injury Association did a public awareness survey recently, and most people in the survey said that they would seek medical attention if they experienced a head injury, but they said they may not seek attention, or one of the main reasons they wouldn't seek attention would be that the injury didn't seem to be serious enough, or they're not experiencing what they believe signs of an injury are. For example, some people think you have to lose consciousness to have a concussion. That's another myth, and one that could lead to really dangerous consequences if people are not getting checked out. The reality is that it's not easy to recognize brain injury, and what we think is not serious, in fact, really could be. On top of that, 81% of adults don't even recognize that a concussion is a type of traumatic brain injury. So when we put it that way, I think it sounds, more serious, and we can probably get people to get more help. So in general, though, why is it important to get checked out right away?
Yeah, so I think timely evaluation can go a long way towards having a good recovery after concussion, since it can help the person to put their symptoms and their expectations into some perspective, and also for those around them. Um, and, you know, uh, sometimes that initial evaluation can pick up on a problem that could be readily treated, as happened to the actress Natasha Richardson. If you remember, she was at a ski slope and fell and hit her head, and um, didn't want to get treated, just wanted to go up to her room. Came down a few hours later, holding her head, severe headache pain, and come to find out, she was transported to a hospital several 100 miles away for treatment. And in the interim, she had a brain bleed, and she actually died of that brain bleed. And that could have all been prevented if she'd gotten a timely evaluation at a local hospital, and they could have picked up on the bleed and done a surgery that would have saved her life and maybe even not had any symptoms afterwards. So a timely evaluation is really, really important.
Great. Catherine, you talked a little bit earlier. I think you mentioned that young girls, are typically screened for concussion a week later than boys might be of similar injury. Can you talk a little bit about screening differences for women and girls? And also, if any of you guys can speak to differences we might see in adults versus children in terms of being screened and receiving care.
With the study that I mentioned, both ours and Children's Hospital of Philadelphia, it was the parents were bringing the girls to care days later than boys. So we don't know why that is. That is how parents are perceiving their daughters, whether they're not thinking, well, she didn't hit it that hard. It didn't seem like her symptoms don't seem like her brother's symptoms the last time someone in our family had a concussion. There are pieces like that. It's also true that often is with teenage girls playing sports, there isn't an athletic trainer there. There may be an athletic trainer on the campus, but they're at the football game. They're not at the volleyball game. So sometimes it's parents not taking them. Sometimes it's that the girls' sports don't have the resources and that there's no one there looking over the girls like an athletic trainer to pull them out of a game. And sometimes it's just a lack of awareness. Boys have video games. Every first-person shooter game has concussion as part of that game. Girls don't have concussion's not a part of girls' play or girls' games. So it's just not part of their lexicon. So they may not be thinking of it that in general. The other time is often women don't get it checked because either between jobs and caregiving for parents or children, there are too many people relying on them that they can't just simply leave and go get it checked. So they may take more of a wait and see approach.
I want to echo what you said again, Catherine. We're always on the same page. And highlight women in sports have a higher rate of concussion than their male counterparts, but people don't think about that. And when we look at high school sports, we know that female soccer players have the same or higher rate than the male football players. And then cheerleading, you go through all of them. You look at field hockey, you look at softball versus baseball. Women have a much higher rate of concussion, and for some reason, it gets missed. So with this webinar, let's dispel that myth. Women and girls have a higher rate of concussion in the same sports.
What about differences in terms of seeking care for children versus adults, older adults in particular? What do we have to worry about there?
I'll jump in on this one for kids. What we know is radiation is never good for people's brain, unless they're undergoing cancer treatment, something like that. But just everyday radiation exposure is not good for us. And for kids, that's even higher, right, with the developing brain. And so what happens is when kids go in and you're not sure if they had a concussion or not, and they get a head CT, that head CT has less radiation, which is good for in some ways, but then you don't get as good of resolution. So most of the time, even if they have a mild concussion, the CT is going to be negative. That's where some of these new technologies are really leapfrogging and bringing us now into this century where we can do a blood test in adults. And now we're looking at it research-wise in children, but we're looking at data now in kids, and these blood tests that are FDA cleared look promising in kids. So we know that these biomarkers do elevate in the bloodstream. And just let me make it real simple. If you guys envision a piñata and you hit the piñata and then the candy falls out, that's what we're measuring. We're measuring piñata candy. We're measuring brain proteins in the peripheral blood, and we have a blood test now in adults that can help us assess that. Your brain proteins should be in your brain. They shouldn't be in your peripheral blood. So we have so many technologies that are coming out and advancements and treatments and so many things that are going to be making the day a bit brighter for everyone in this situation.
Yeah, thanks for sharing that. I think I just want to really reinforce what you said about CT scans or MRIs, because sometimes those do come back clear following a head injury. But those biomarkers and some of the new diagnostic tools really seem to be advancing the way that concussion detection occurs and can really help people to discover and receive those diagnoses that they may not have been receiving before. So really great information.
One thing I do want to add there is it is a myth that if your head CT is negative, you did not have a brain injury. The vast majority of head CTs are going to be negative. So even if you had a concussion, 90% of those CTs are going to be negative. That doesn't mean you didn't have a brain injury. That just means that you didn't have a brain bleed or a skull fracture.
Yeah, that's very good. Another recent learning from the BIAA survey is that less than 1 in 4 adults report being screened for history of a brain injury when they're visiting a healthcare provider. So we know they take a lot of background information about our health, but people aren't being asked about brain injury. So I'm curious, Kelly, as a brain injury survivor, what has been your experience in interacting with healthcare providers, and why do you think it's important for your providers to be aware of your brain injury?
So, unfortunately, or maybe fortunately, for me, it's impacted so many of my other, bodily systems that it inevitably comes up. But it's not, them asking. It's me saying, oh, and after, my brain injury, all of these things happened. Can you help me, find answers and everything? But yeah, I think it's so important because it affects so many different things, but people aren't asking because they don't think to ask. And I also like with going on even just the initial visit, to a doctor, a lot of us will be in the ER or in primary care, and these doctors have so many things to cover that they may not be as up to date on, the current protocols. And I know for mine, I was told to, do the silent dark room for 3 months or until, like my symptoms stopped, which was even then they should not have been telling me that. And so if you feel like you're being dismissed by even your doctors, there's so much misinformation and it's really hard for them to keep up. I would definitely reach out to organizations like Concussion Awareness Now or the Brain Injury Association of America's helpline. Don't ever think that your brain injury, because it's just a concussion, isn't worthy. Like, you'll be wasting someone else's resources if you call in, because they can give you the most up-to-date information. They can tell you what to do. They will tell you about return to play, return to school, not like doing the don't ever sleep if you have a concussion, because, that could be dangerous. That's no longer good advice. The silent dark rooms, that should not last, more than, 72 hours or something like that. So just if you feel like you're being dismissed, there's so much misinformation and it can happen, in even a doctor's office. So I would just make sure to check with these sources that will be able to give you the most up-to-date information.
I agree with that. And I'm looking at some of the questions in the chat about ERs not educating on concussion. And I think it's important to go to the ER and check to see if more sinister things like a brain bleed are present. And then once you leave there, it's to follow up with your physician or a sports concussion clinic or a concussion clinic where you are going to get the education, because it's a couple of hours of talking to somebody, hearing about your life and what the recommendations are for you, whether you're, a third grader who's just has recess, or a high school athlete, or a mom, or they need to build the protocols around you, and the ER doesn't have time for that. They're just to make sure you're not, fatally injured. So I wish the ERs had time to do that education, but you really need to see, a good PCP or a good pediatrician that can go through that education that you need at that point.
And Kelly, I want to say you're spot on with ERs missing this. There was a study published that showed half of people that have a concussion sitting in an ER are missed. It came out of some work from Track TBI. So they're in the ER and yet that gets missed. And you think, well, how can that be? Well, people usually come into the ER because something's going on, and maybe they were in a car wreck, or maybe they fell down the stairs, and then there's more attention paid to the broken leg or the broken shoulder or whatever unfortunate thing happened. And brain injury frequently is it's an invisible injury. It's one that you can't see, right? So I bet you, Kelly, people have told you look great, and you feel terrible, right? When somebody twists
Yeah.
their ankle, yeah, When somebody twists their ankle, it's huge, it's painful, you can see that. But when someone injures their brain, it's an invisible injury to many. Yeah.
Yeah, this is so important. The next question that I was thinking about is just about rehabilitation therapies. And, obviously, if people aren't getting diagnosed, they don't have the opportunity to have proper rehab and potential recovery from their injury. And so I'd like you to speak just a little bit more about how rehabilitation therapies can help brain injury. We know some people will have lifelong symptoms, but again, improvement may be experienced by others. Dr. Drew, can you jump in here?
Sure. Yeah. Depending on the types of symptoms that the person's experiencing, whether they're physical, cognitive, emotional, or sleep, there are rehabilitation therapies like physical, occupational, speech therapy, neuropsychology, which can help them either reduce or manage their post-concussion symptoms. And the way that happens is really by learning new techniques, learning new ways of dealing with the symptoms. Um, and for example, some forms of headache might be managed by a particular type of vestibular therapy or physical therapy, and problems with memory can be addressed by neuropsychology, occupational therapy, and speech. So it's important to get access to those rehab therapies, especially if symptoms persist beyond those 4 weeks.
And one thing that I wanted to add is the TBI world is gathering internationally right now to look at the terms we use to describe brain injury at the NINDS and the NIH to try to figure out. We talk about brain injury when you get the diagnosis in the moment, in the room, where you say you're in the ER, you have a diagnosis of mild, moderate, severe. And then how do those words really just, they don't work for doctors and they don't work for patients and their families, because it doesn't talk about how in the future what we think the recovery time is. So they're working on a new categorization of how we speak about brain injury. And I saw it last week at the Brain Injury Congress in World Brain Injury Congress in Montreal. And that hopefully in the next 5 years, we'll see a new terminology and language where we use different scales and we use biomarkers and we use ways of talking about brain injury, so we more have a better idea of what's the injury in the moment and what's the recovery outlook, because we have mild TBIs that take years to recover, and there are moderate to severe TBIs that don't have as long recovery time. So the terminology is bad, and
That's
everyone
right. I agree with you, because it just kind of sticks in my craw when it's called mild. No brain injury is mild. It can be absolutely devastating to that person, and you have to make sure that they get in and get treated. And when they're labeled with something as mild, people may think, oh, I don't need to address it, it's mild. When in fact, as Dr. Drew just talked about, there's a lot you can do, but you can't do anything if it wasn't assessed and evaluated. I agree with you, Catherine.
Yeah, and I would just add, it's really important to distinguish between the degree of injury, the initial degree of injury to the brain, which, might be described as mild, moderate, or severe, but then the subsequent disability that a person might experience, that can be totally unrelated to the mild, moderate, or severe. So you could have a mild brain injury with severe disability, or a moderate brain injury with only mild disability. It really depends on so many things, like, where in the brain the injury is, what kind of help the person has gotten. So we do need a new nomenclature that really helps people distinguish those two things, the degree of injury and the degree of disability.
Mhm.
Yeah, and I think that nomenclature is going to be published this year. I've heard
It's
that some of
coming.
that will be coming out, and that'll be huge. And the fact that we'll have objective tests in the diagnosis, the current diagnosis of mild, moderate, severe is based on Glasgow Coma scale, right?
Yeah,
And it's
yeah.
what is Glasgow Coma scale? Are your eyes open? Perfect score. Can you follow command? Perfect score. Can you speak spontaneously? Again, perfect score. And you can have a perfect score on the Glasgow Coma scale and still have a brain injury. So having something that's objective, like a blood test in these new guidelines, is going to be absolutely life-changing.
Very exciting.
So we've talked about causes of concussion. We've talked about symptoms, getting checked out, potential rehab therapies. I want to shift to just thinking about prevention. Another myth that I've heard is that helmets can completely prevent concussion. And, we don't want to be discouraging. We know that helmets can reduce the risk of severe head injuries. But can you talk more about prevention in general and what we can do to try to protect ourselves?
Well, yeah, I think I've heard people say, well, why don't they just make helmets stronger or bigger? Why don't they wear helmets in soccer, right? So, but it is a myth because the helmet can protect the outside of the skull, but it really can't prevent the brain from rocking back and forth inside the skull, which is what happens when there's force applied, even if it's like force from an IED explosion. That rocks the brain back and forth inside the skull. So even if you're wearing a helmet, that's not going to prevent the diffuse axonal shearing, also called DAI, which occurs at the microscopic cell level, at the neuron level in the brain. And that's not visible on scan, like Dr. Beth was saying. And the helmet is not going to prevent that from occurring. Other prevention strategies that we know can work include things like in sports, for example, reducing the percentage of time that the athlete is involved in contact, like having non-contact practices. That could actually reduce the risk of concussion for athletes by as much as 75%. So we got to look at other ways to do prevention. And I loved Dr. Beth's initial comments on that because I'm getting to the age where I need to listen to everything she says.
Well, let me talk to you about yoga later.
Okay.
Work on your flexibility and balance, Dr.
There's
Drew.
another one, yeah.
I think unfortunately a lot of products are sold over the decades. You can go back to the 50s and 60s and looked as we transferred from leather helmets to plastic helmets. There's always this construct that technology is going to make the reduction of brain injury because of this new thing. And if you spend this money, and unfortunately the marketing gets better and better, and the concussion rates, what I find with three sons, you put a helmet on it, the first thing they do is run at a wall. It
Yep.
increases every sensor I ever brought home, they went and put on their head and tried to clunk it with it. So sometimes throwing a bunch of gear on someone can make them play more aggressively and change the behavior. It's about rules, respecting the referee, respecting the coach in that sporting situation. Always when you're on a scooter, a motorcycle, a bike, any opportunity that you had to add safety equipment to anything that's moving, absolutely.
I'm going to add to that. The best injury is no injury. So prevention is key. I was recently over in the Netherlands and lots of bikes, good for your cardiovascular health. Nobody was wearing a helmet. Come on, you guys. So please wear your bike helmets. The other thing that I've noticed is an uptick. About 5 years ago, we were seeing more people enrolling in our research trials for brain injury because of texting. Texting is still a problem, right? Don't be in motion in texting, please. Don't walk and text. That's another one. And then my big tip that we're seeing astronomical increases in people getting head injury would be from those e-scooters. So if you aren't trained on an e-scooter, please don't get on an e-scooter. And if you are going to be on an e-scooter, make sure you wear your helmets. And parents, talk to your kids about these e-scooters. We're seeing so many catastrophic injuries from the e-scooters.
Yeah, and Dr. Drew, I think I've heard you and others speak also about frequency of impact and kind of the cumulative effect of being hit. So, what can you say about that when it comes to sports or activities that do have impact?
Well, unfortunately, we've learned a lot about this from our work in prisons, where we find that up to 90% of people in leaving prison have evidence of a lifetime history of brain injury. 90%. And when we look at the nature of these injuries, it's not just one injury, but it's as many as 4.1 injuries on average per offender. And most of them were mild brain injuries, and most of them occurred before the age of 21. But they were not properly diagnosed. They didn't get proper treatment, and they ended up in a life of crime. So, I mean, it's a shame we have to learn about it that way. And certainly not everybody who has multiple untreated brain injury ends up in prison. But it does tell us that, you're more likely to, once you have one brain injury, you're 3 times more likely to have a second. And once you have a second, you are 8 times more likely to have a third. So the likelihood of multiple brain injury continues to go exponentially. And I think that's especially true when the first injury is not properly treated.
And just to add from the women's point of view, the studies in the United States and in the UK and some in Australia have showed that women in the justice system have also have an 80% prevalence of brain injury, and in most cases, it's from domestic violence or intimate partner violence, family violence. It varies on the country what it's called, but it's being hit by someone in your family, a lover, a partner, a husband. So it's really a problem in the justice system for women.
Mhm.
I am in the Q&A and I'm seeing a couple of questions just about training for medical professionals and resources available to healthcare professionals. Can we talk a little bit about that to how can we help ensure that our care providers are better equipped?
I'd love to weigh in on that if I could. So the Brain Injury Association has a whole academy called the Academy of Certified Brain Injury Specialists. And these are people who've gone through training and have taken a national certification exam so that they have a shared understanding of brain injury and how to work best with people who have brain injury. And the Academy has also just developed a new course called Understanding Concussion Symptoms, Diagnosis, and Treatment Approaches. It's a certificate course designed for medical professionals, maybe even medical professionals who haven't had experience with rehab like I've had the good fortune to have. So more of the frontline kind of people that don't always seem to understand concussion very well. So I think that in the follow-up to this webinar, we can send out a link to that course. The other thing I'd like people to know about, though, is that the Commission on Accreditation of Rehabilitation Facilities, also called CARF, has a new accreditation out there for those concussion clinics that are doing concussion rehabilitation. So when you're looking for a provider with training and experience in concussion, look for that CARF
Mhm.
certification, accreditation, and you will know that they have achieved a high level of training.
I think that's great. That's fantastic, Dr. Drew. I think you're spot on with that. And then also, I would encourage everybody that's listening to this, be your own expert too. Just know where the resources are credible. And BIAA, in conjunction with Abbott and some other folks, 20 other groups, have put together an amazing concussion awareness now site. So go to concussionawarenessnow.org. Go there, look everything up now. Take 5 minutes, screenshot it, and have it in your pocket. Just don't be walking and looking at it.
Dr.
Good
Drew,
to know.
as patients, is there a way that we can find those list of accredited practitioners or concussion clinics so that we have a better idea of, where to start or, who we can trust?
Yeah, so accredited providers are listed at carf.org, CARF.org. You can find them there all over the country, all over the world, actually.
Be very helpful. Thank you.
That's great. Oh, I thought I heard someone jumping in. If we can just do a last round, like a round robin, and just hear from each of you, I'd love to hear your final takeaways about what's most important and any additional resources that you want to share. Kelly, do you want to start?
Yeah, I'm gonna echo what Dr. Beth just said. Become your own expert. Know that your health is the most important thing in your life, and just make sure that you're looking at reputable sources. If you need help with, trying to find reputable sources, please contact Concussion Awareness Now or the Brain Injury Association of America, their helpline. There's no question that's, too little to ask. Please do it. This is so important, and the quicker you get help, the better the outcome. And just because you have been living with this for a long time, please don't give up hope. Please know that there's always a chance of recovery. There's always a chance of improvement. And just believe in yourself, believe in your recovery, and know that there's so many people out here willing to help and willing to assist you to find those resources.
Awesome. Catherine?
I think it's really important to get support, to be a part of a support group. There are many online support groups. Pink Concussions has a number of them, but there are other groups out there. And the isolation, I think, of a brain injury, to have an invisible injury that your family, your employer, your children, your parents, if you really don't feel understood, that's a very hard, isolated place to be. So seek that support from a group where you feel heard and supported.
Awesome. Dr. Beth?
I want to end with there's always hope, right? So have hope. Just like Kelly referred to, there's so much that you can do and be your own advocate. Really, truly, go to concussionawarenessnow.org, check out BIAA's website, and know that you can do things such as meet with a registered dietitian to optimize your brain health. Nutrition plays a huge role in recovery. So you can seek out that. There are also different supplements and vitamins that you can take, getting a good night's sleep, a graduated exercise, all kinds of things to bring you back to you so that you can be your absolute best. So hope is my takeaway.
Great. Thank you. And Dr. Drew?
I love everybody's optimism on this call. Can we just bottle that and sell it? So I agree with everything that's been said. I think it's very important for people to be evaluated and treated early after a concussion has occurred or is even suspected. And other ways to find those professionals with training and experience are almost every state has a Brain Injury Association, a state affiliate of the Brain Injury Association of America. If it doesn't have it, it's covered by BIAA, and you can call the National Brain Injury Information Center helpline, and you will get routed to help in your state, and they can help you really to find those support groups that Catherine mentioned. They can help you to find the accredited providers in your local area. So use those resources. We'll send it all out to you in a follow-up email.
We will. Thank you so much. You guys have all shared some really great information. I know we have some questions in the chat that I think we do want to address live, some additional questions. Steve, will you share those?
Yeah, so we've gotten a number of questions here. I think that, trying to summarize, there's a few questions here that people have about treatment options available after getting a concussion. So somebody asked, is there any rehabilitation available for someone that has lost their sense of smell and taste since suffering from a concussion over 3 years ago?
So there are places that specialize in smell and taste, and that can really be a problem because if you take the blow to the front of your head, the cranial nerves that communicate smell, which is of course necessary to experience taste, are right behind the nose. So if you have a broken nose, there's a chance you're going to have a problem with smell or taste from that impact, and it has to do with the cranial nerves. and the
Mhm.
part of the brain that interprets the senses of smell. So there are places that specialize in that, and if it hasn't come back after, a month, I would get to those places for specialized treatment.
Yeah. That made my neurologist heart happy that you mentioned the olfactory cranial nerve. Thank you, Dr. Drew.
I
Also,
think,
go
go
ahead.
ahead.
I was going to say, also, you can work with a registered dietitian too, and some of the sensory experiences, and really bringing in different flavors so that you can get that sensation. And then I highly recommend going to some of these olfactory rehabilitation centers. I think that's an outstanding idea, Dr. Drew.
I think the problem I see a lot in the support groups is that in the past, if people have brain injuries a number of years ago, they were diagnosed with something, the term we don't use anymore is post-concussion syndrome. And they have this syndrome and they need to rest their brain and not challenge it. And if anything, the last 10 years have showed that we look at subcategories, trajectories, where if it's headache, they're headache specialists, whether if it's a mood disorder, there are a therapy that is saying, or if it's visual, there are visual therapies that concussion is broken down into these components. And depending on what component or what symptoms are a struggle to you in your life, then you can find experts in those fields. And if you walk in and a doctor's like, oh, post-concussion syndrome, and doesn't seem to be able to break it down, then go to the next doctor. Not every doctor
That's right.
is trained out there. And if it doesn't feel right to you, go to the next doctor.
Mm-hmm.
It
Yes.
really sounds like the individualized treatment, and like we talked about earlier, individual symptoms different for different people, but really targeted treatment based on your experiences.
Right.
That's great.
Yeah, I would say brain injury is very much like real estate. It all depends on location, location, location. It really is. And also that and the brain that you bring to the injury, we all have a different makeup. So we know that some people given a sort of injury will bounce back very quickly. Other people, given their genetic makeup, it's worse. So it really is individual and it should be titrated to each person. That's absolutely essential.
There's a question in the chat about mental health and addiction. And if those were not black boxes, just as Beth said, when we come to concussion. So if those things are percolating in your life and in your genetics before a brain injury, the brain injury can exacerbate those.
Yep.
And not meaning that you can't be treated for those, but you may need to go where, a mood disorder or depression or anxiety or ADHD was something you could pretty much handle before the brain injury, but after the brain injury, it is really causing stress in your life. Even more reason to go in for that targeted care and successful ways to be supported afterwards.
And also adjusting to such an enormous life change and the isolation that you experience, and just realizing so many things that you used to be able to do, you used to be able to love, you can't do it. It's an incredibly difficult situation. So please don't ever hesitate wondering, like, is this bad enough to get seen? Should I like feel embarrassed that I'm not grateful enough? Like I survived this? There's no shame whatsoever. Again, you're never taking resources from someone else by getting care for yourself. So
Right.
if you're even considering like, hey, I might be depressed, I might be anxious, as a result of this, please get it checked. You deserve help. Everyone deserves help.
Well said, Kelly. And
Yeah.
if you can imagine, like something like a head injury happening, and suddenly you're having differences in the way you think or act or feel or can move. I mean, that in and of itself is going to produce anxiety. It's going to produce depression. So these are almost like normal reactions to a concussion, but
Right.
we need someone who's willing to help people put that into perspective and work through it, and not make it into a bigger problem than it needs to be. And I always think that the substance abuse, I like what you said, Catherine, about if you may have a predisposition, but now you really cannot handle it. Well, also what we see is that um, the use of substances is sometimes a maladaptive approach to either handling this change in your functioning or the anxiety and depression that normally accompanies it. So there's nothing normal about it. You got to get the right kind of help, and then I think you can avoid some of these downstream mental health problems.
Yeah, for sure. Steve, what else from the
Yeah.
Q&A?
Yeah. So we had somebody ask, can you talk about repeated head impacts? It's my understanding that repeated head impacts can leave long-term damage to the brain that may go untreated and can lead to long-term behavioral and substance disorders and potentially CTE. Can you elaborate on that?
Sure. I mean, I'll give a stab, and please, someone else join me. I mean, the repetitive impacts that we now understand, especially, you know, professional league players take over their career, can be as many as 80,000 hits in a career. And now what we're learning is that even the subconcussive blows can produce changes in brain and result in long term in this chronic traumatic encephalopathy, which is really different than, a regular, if there is such a thing as other brain injury. It's a progressive condition. And most often brain injury is not that. So, we need to take into account even subconcussive blows, and especially with our children, think about that, in their, are there ways to protect them and to minimize that, and yet still have them be able to enjoy sports?
I
But
think
I'll add and build on that is it also depends on, again, your genetic makeup and what brain you bring to the table. And then number two would be how soon after the first concussion did you get it? We know that the cement, if you will, isn't set yet. So your brain is particularly vulnerable within the first week or two after injury. And even after your symptoms have gone away, we see changes in functional brain imaging for quite some time. So it depends on your brain and how rapid it was in the type of injury that you got. That said, it's not inevitable. There are treatments, interventions, lifestyle things that you can really lean into and work with as your clinician. The other area where we see this is really being a problem, and we're just now getting more research on this. And Catherine, this will make you happy. We've launched a big domestic violence study that we're doing. And so the other big problem is domestic violence. So folks that are hit repeatedly, it's a big deal. So how can we intervene? And if this already has happened to you, how can we make it better? Working, of course, with your team. We know that exercise is fantastic. It can be as simple as a walk. Make sure that you're safe to do that, but that's a big deal. The power of green, getting outside, making sure that your circadian rhythm is back in tune. So getting outside within half an hour of getting up without sunglasses on. All of these kind of things are really important, as well as nutrition. Nutrition is profoundly important for your brain. And I'm not just saying that as a neurologist, as a dietitian, it really does matter. Your brain membranes are literally made up of what you eat, and your antioxidant levels vary in your brain depending again on what you eat. So there's so much that you can do.
I think the stats that Dr. Drew shared earlier about the increased risk for your second and your third concussion are so powerful. I think that if you are in a position of power, whether, you're a doctor, a coach, you're working at, a shelter to try to help so many of these people, I think we all have an obligation to share those stats so that people realize just even if you don't have that many symptoms, from the first or the second, we need to realize like how important these are and how severe like it really can be.
Yep.
So that way we can prevent, because prevention is so much more and it's not something you should just shake off. We need to really emphasize that point that they can get worse and they can become so much easier, and that's not something we could just ignore.
Yeah. Right. Yeah. Course correct before you crash into the iceberg. And after you have your first concussion, your brain is more vulnerable, right? And then in addition to that, things like your reaction time is slightly off. You may not even know that, but it is. And your balance can be off. All of these kinds of things that your operating system is not quite back to how it used to be. And again, as I mentioned earlier, but it bears repeating, we see functional brain imaging, even when somebody's symptoms have gone away, that the brain is not finished healing yet. So do not get another one. If
Yeah,
you
and your
can
balance
prevent
being
it.
And I'm in the category of multiple. I've had over 20 concussions, and there are a number of us. I used to think I was the only unique one. There are a number of us. It's not, it's not really a proud thing when you get up in front of a group of people and share that. But there are a number of people out there with multiple concussions. And yes, we have a higher rate because we are more susceptible to them. My concussions resolved. 15 years ago, I was very worried about CTE and a CTE study. And now that I've been to NIH and watched the definition of CTE evolve and looked at the scans, I'm not worried about CTE. I've had multiple concussions, but I haven't had 800 hits since I was 5 years old every year while I was a developing child. So when people call me worried about CTE, I said it's much better to work on focus on your nutrition and your exercise, and that there's no point in which brains won't heal and neuroplasticity. And I think it's much better to focus one's life on what can I do well for to keep my brain healthy as it is than worrying about past. I recently got hearing aids, and hearing aids are one of the biggest modifiable factors for dementia, where brain injury is considered 3% of what you can modify, and hearing aids are 7%.
Yeah.
So there are so many things that one can do to increase their brain health. It's a such better path to travel.
Love that.
So I know we just have a minute or two left. There's so many questions in here that we will follow up on. But just one last question for our live panel here. So somebody had a question about cervical injury and concussion, so hyperextension and whiplash. My experience is the healthcare providers didn't acknowledge or connect the two injuries together in treatment or in rehab. Has this changed?
Well, historically, I think people looked at whiplash victims as just trying to game the system. And now I do think we take it more seriously and we do evaluate it and we do understand the possibility of brain injury in conjunction with that. I hope we do. The fact that the question comes up suggests that maybe we still have a ways to go on that.
And that's another myth. There's a myth out there that says that you have to hit your head to get a concussion, and that's just not true. And whiplash is absolutely in that category. When your head goes violently forward and back, you can get a contra coup injury, and you can absolutely have brain injury from that. And yet, when you look at the outside of someone's head, there's no swelling, doesn't look like there's a problem. And then you do the head CT, looks like it's okay. So that's really combining two myths together, right? You don't have to hit your head to get a concussion, and if your head CT is negative, you can still have a concussion.
Yeah.
Great question.
Well, this is really great information that we've shared today. I just want to thank our panelists again and everyone who's joined our webinar today. The same BIA public awareness survey I've been referencing found that 8 in 10 adults agree that there is not enough public awareness about treating brain injury. So we hope the information shared today will help to increase awareness of the causes and symptoms of concussion and the importance of receiving care. We hope that everyone who's been a part of this will take what they've learned and start a concussion conversation. So thank you again. And we will follow up by email with a recording and answers to some of the other questions in the chat. We are concluding this webinar.
Great to be with you guys.
Thank you all.
Yay.